Good morning, everyone. We are so thrilled to have you join us in today's expert led course on attaining practical solutions for autoimmune disorders. My name is Myra Chen, and I'm your host and moderator for today's webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are so proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. We really appreciate you all being here with us today. Today's class has 3 groups. The first group is our Watch It Free group, which means you signed up for this class with a coupon code to watch for free with no CEUs. However, you can upgrade to our second group, the paid group. This group will give you access to the CEUs and video recording for 4 weeks. And finally, our premium group, the Gold Pass. Gold Pass members will have access to the CEUs and video recording for 1 year, in addition to over 3,000 plus hours of TCM content and unlimited CEUs. In addition, you also get sponsored benefits. This includes a 10% discount from Helio and an Evergreen Herbs collection formulas voucher from Evergreen Herbs. Now, let me introduce you to today's speaker, Cesar Torres. Cesar was born in Puerto Rico and has had an extensive career in TCM. He established his own practice in 1987 and has served the greater Los Angeles area as a dedicated healer, touching the lives of thousands of patients. Over the years, his dedication to meditation honed his understanding of the intricacies of health. In 2014, after years of tireless service, Cesar decided to retire, leaving behind a legacy of healing and compassion. Today, he resides along the beautiful coast of Brazil, where his love for nature and holistic well-being continue to thrive. How many of you have found managing autoimmune disorders challenging in your practice? Type yes in the chat if you have, and please share what aspects you find most difficult. We hope you will learn how to treat immune system disorders with today's webinar, all-inclusive, simple, and effective acupuncture protocol for immune system disorders with Cesar Torres, sponsored by Evergreen Herbs. We will be delving into Cesar's wealth of practical knowledge and insights, in which you will learn the flexible acupuncture points that address the organs and glands involved in stabilizing various hypo, or autoimmune disorders. Cesar's approach blends the insight of ancient principles with modern applications, offering actionable strategies for healthcare professionals and individuals alike. Now, some quick housekeeping. Let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone. That way, everyone can be part of the conversation. To ask questions during the webinar, use the Q&A box so that they remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Cesar Torres. Good morning, everyone. This is Myra. Welcome to today's class with Dr. Torres, who we appreciate and look up to so much. And in honor of him dedicating this class for free to help the students of TCM, we are giving away 5 distance learning courses today. So we will be doing a raffle drawing after the break and before we start the class. So make sure you come back from the breaks on time. And let's get started with today's class.
I'm glad you're all here to see this seminar. This is the all-inclusive, easy, and effective acupuncture protocol for immune system disorders. I'd like to talk about the origins of this protocol, how it came to be, because it is a very intimate to me how this all came to be. And it started some time ago when I was in New York City and health food was becoming a thing. Before, there were no health food stores. But then, little by little, there were health food places, and I became interested because some long time ago, a man spoke to me about life longevity, how to come about having a healthy, long life. And it struck a nerve with me. I said, what is this all about? And I got on a path that became later not only my own health, but the health of others, and how to help people become healthy. At around age 27, I found meditation, transcendental meditation. And it opened up for me the field of the inner consciousness, alertness, awareness. And I started to become more and more interested in life longevity in terms of well-being. How I became interested in this particular protocol was because the immune system hit home. My wife at the time was diagnosed with lupus, the worst type of lupus, the erythematosus. And it became a challenge because Western medicine did not really have the right answers or the cure. And to this day, I'm not sure if there is a cure. There are some medications that can help control when the autoimmune system flares up and attacks the person. But I started to question after several rheumatologists that we saw the best rheumatologists in Los Angeles. And they prescribed medication that I had questions about. Because the theory in those days was to either suppress the immune system or to stimulate the immune system, to make the immune system stronger. And I didn't see any of that working. I didn't see that suppressing the immune system or making the immune system stronger to fight off something, they were not working. Then it occurred to me that to balance the system, you had to have regulation of the immune system. You had to regulate the immune system rather than suppress it or enhance it, regulate the immune system. How to go about regulating the immune system? It was a mystery to me, but a challenge, especially since the immune system was attacking often in my home. So I began to do the research. Around that time, I found TCM, traditional Chinese medicine. And I began to research within it as I was studying, focusing on the immune system. That was my main interest. And it drove me more and more, deeper and deeper into the whole idea of how to heal, how to become balanced as a system that is regulated. I listened to all the professors. I did my own research. And I was having the intimate experience of having to go with my wife to the emergency room and how they were treated at the hospital and how she was being treated with the rheumatologists. The experience came about where after I graduated, after I had my license, I opened up the clinic, and to my surprise, there were many people with immune system disorders, a big variety of them, but they were all stemming from an imbalance, irregularity of the immune system. I really came into question what were the points, what were the systems in the body that needed to be addressed in order for the immune system to be balanced. The word came up, homeostasis. For me, homeostasis and balance of the immune system is one and the same. I started to wonder exactly how the human system could be balanced. And I knew that with meditation, one gained a deep sense of the self, a deep sense of calmness, relaxation. It brought down the stress levels. I also knew that in the traditions of Chinese medicine, there was many practices to do the same. Amongst the Qigong, Tuina, Tai Chi, I was focused on acupuncture. And acupuncture for me was the way that I had to go in order to connect with all the internal parts, all the mechanism of the immune system throughout the body. And that's how each of these points came to be. I tested these points over the last 36 years on many patients of all ages, of all sexes, and lo and behold, everybody got better. It was not an ultimate cure. I can't say that I have cured anybody of anything. However, the regular maintenance with this acupuncture protocol did make a lot of people happier, a lot of people better, healthier. And I saw that at one point, thanks to the motivation from Tina Chen, who I spoke to, I never thought I would ever be doing a seminar, but she inspired me. And I thought, you know what? It's time to share this technique, this protocol with other acupuncturists. It will probably benefit a lot more people. So I'd like to get started with how I found how to balance the immune system and bring about homeostasis. Now, I've prepared a slideshow, and the slides are going to guide us through the whole understanding of what it takes to be, what it takes to actually balance the immune system. And once you balance the immune system, it doesn't matter what condition comes about or comes to your office, because whether it's rheumatoid arthritis, fibromyalgia, whether it's from allergies to, in my time it was SARS, now it's COVID, it doesn't matter, whatever is throwing the immune system out of balance, you know that with this protocol, you can bring it back into balance. And if the patient continues once a month to stabilize again the immune system, they will feel much better in the long run. So let's dive into the actual rest of the seminar.
Hey, Dr. Torres, go ahead and start it.
Yes. In the introduction, the video introduction that I made, I covered most of these points. There's one that I overlooked, and that is the one that you can read below, says intuition and cognition. When I actually developed this protocol, I wasn't working with the knowledge that I have now because of AI making everything so readily available. I was working with my intuition. And I kept, with every patient and every treatment that I did, I consulted a meditation, and in my intuition, what I felt was the right thing for this patient. And there's a difference between just a regular intuition and actual cognition. Cognition is when you know something that you don't know or ever researched or studied from anyone. That cognition can occur if you focus and keep after asking the question, what is it that needs to be done here? And then going inside. Yes, the intuition is there and it guides you because you get on the path. You get to know what it is and where you want to go and what you want to do, the problems you want to solve. But if you wait patiently, something comes where you begin to say, oh, I know this. It's not just that I think it's correct. I know it. And you have that confidence because you are working with a level of understanding that no one has to explain to you. If you've been meditating as long as I have, 54 years meditating day and night, morning, afternoon, and afternoon meditations, you begin to understand that level of I hate to say thinking, because some things you don't think, you just know them. It's a sense that you feel, and then something from inside you comes up and you say, I have full confidence in doing this. And that's something that when I was studying the idea of homeostasis, which really homeostasis, balance, is really the yin and yang understanding of nature, the yin and yang understanding of the human condition, where there is an extreme activity and nothingness. When the nothingness and the everything come together, and the yin and yang concept encompasses the complete understanding of existence. I had to share that with you because that, for me, became the guiding principle to understanding homeostasis and the balance of homeostasis. Let's go to the next slide. Next, yes. The definition of homeostasis. Keeping everything in balance. Homeostasis is the process by which an organism maintains a stable internal environment despite external changes, surviving by adapting to its surroundings. there's one word I would add here, and that is to be able to adapt to the surroundings, no matter what the surroundings throw at you. The person has to be able to adapt. The patient who comes in has to have an acceptance of the natural process of life. And very often people who come in with an imbalance of the immune system do not accept everything that is nature, that is normal. And I throw in the word normal because homeostasis is really achieving normalcy. When a person is completely normal and living a completely normal life, the homeostasis immune system is balanced. It doesn't throw anyone out of balance. So this is for me one of the key understandings of all the philosophies of all the masters who are teaching life longevity. The actual basis of life longevity is keeping a normal homeostasis level of being. Let's go to the next slide. The immune system, as defined in modern everyday terms, is a combination of all these different organs. The adenoids, which provide white blood cells at the mouth and the nose. The tonsils. For 5 years, we developed tonsils. During those 5 years, they're filtering and fighting bacteria, viruses, and one other thing that's very interesting. It creates a memory. The tonsils create a memory of what tastes good, what doesn't taste good, what you should avoid, what you like, and creates a memory that is embedded for the rest of your life. The thymus. The thymus is where T cells, T lymphocytes, where T cells mature and from there released into the blood. The spleen. The spleen detects pathogens. It filters the blood and it has antibodies. The intestines detects and responds, especially with serotonin, a hormone we're going to speak about later. Peyer's patches are a bunch of patches that are in the intestines that defend against dietary antigens. The appendix, we all know the appendix and the problems it can cause. It has lymphoid tissue that fights infections. The bone, especially the marrow, where the cells, the red, white, yellow, and platelets are developed. And then the last, lymph vessels and lymph nodes, which are in all parts of the body, upper, lower, and middle, and they filter blood. Next slide. Next. Oh, good. The similarity between the immune system and the lymphatic system. They are pretty much one and the same. As defined modern day, the immune system, when you compare the definition and all the organs and glands that are considered the immune system and the lymphatic system, they are practically 99.9% the same. My understanding is a bit different. Next slide. I call this the all-encompassing immune system. The immune system is not just the lymphatic system. You have to recognize the limbic system, endocrine system, autonomic nervous system, digestive system, and reproductive system. From experience, I had to deal with all of these areas when I treated the immune system. I had to find how to address the limbic, endocrine, autonomic, digestive, and reproductive systems in order to be able to really balance the immune system. Next. This is where it all starts. The functions of the lobe of the brain. The frontal lobe, this is where memory, mood, motivation, and emotional expression, behavioral control, and mental flexibility. That's the home. The parietal, where is the touch, taste, smell, visual perception exists and lives. The occipital, visual interpretation and recognition. The temporal, memory, hearing, learning, feelings, information retrieval. That means when you go back and you want to get that information you had, the memory, that's also in this part of the brain. Cerebellum, the balance and equilibrium. The brainstem, where the autonomic nervous system controls the heart rate, reflexes, blood pressure, ability to sleep, and consciousness. When I came to understand this as part of the functioning that we have to be aware of, I said, okay, now I know where to focus the treatment pattern. Next slide. This is the limbic system. This is what lives in the brain. You have the different areas of the brain that do different functions. Now I'm going to go directly to the next slide. Next slide. And I'm going to explain the functions of the limbic system. The pineal gland is where perception and consciousness begins. The pineal gland is how you perceive things. And the area of consciousness that allows you to go, when you close your eyes, inside. The hypothalamus. The hypothalamus maintains homeostasis. The pituitary, where the hormones are distributed, they work in coordination. The amygdala, this is the adapting behavior to environmental changes area. The thalamus, sensory transmitter. So you transmit your senses to your inner being from the thalamus. There's sleep, alertness, and consciousness. The basal ganglia controls movement, emotions, and cognition. The cerebellum, the cerebrum, perceiving, thinking, language, voluntary movement. Cerebellum, balance, movement, motor learning, vision. Cingulate gyrus helps regulate emotions and pain. The hippocampus, learning, factual memory, and neurogenesis. Now, factual memory means that you remember the facts. And neurogenesis is the ability to reproduce and recreate and regenerate genes. Let's go to the next slide. The hypothalamus. This is really the headquarters of the yang qi. The main function is homeostasis. This is the guiding, so to speak, in a courtroom, this would be the judge. It directs hormones to the autonomic nervous system, especially the vagus nerve, which we're going to go into much later. And I know I'm simplifying. I am not an endocrinologist, but I am simplifying for the sake the purposes of this acupuncture protocol seminar, I want to focus on the hormones, the general hormones that are the feel-good hormones and the ones that are the fight or flight hormones, the adrenaline, cortisol of fight and flight. There is a decision-making aspect to the hypothalamus. It works with the pituitary. It works with the nervous system, but it is where the first decision-making reactive response to whatever's going on occurs. Let's go to the next slide. The hypothalamus and the pituitary, they are constantly working together to distribute, release, and distribute the hormones of either dopamine, melatonin, oxytocin, serotonin, which are the feel-good. And I consider the hypothalamus and the pituitary the yin and yang organs, glands, that are sort of working with each other to stabilize and keep the system normal. Next slide. This I found interesting. Of course, studying meditation from different areas of thinking, from India, from China, from Japan, from the Middle East, all the different concepts that came to be known as the chakras. The chakras and the endocrine system are 100% in agreement. And we overlook the function of the chakras and the function of the energy that has to be moved through them. If you look, for example, the crown chakra is defined as the pituitary. The pineal gland is defined in the chakra system as the third eye. The thyroid, the throat, the thymus is defined in the chakra system as the heart. The thymus, where the immune system headquarters resides, is considered the heart, where the rhythm resides. The pancreas, the solar plexus. The adrenal glands are considered sacral, and reproductive glands are considered the root. It's not, I don't find any real difference between the healing technique of Chinese medicine, TCM, and the chakras, and any of the concepts of the masters who speak in terms of the energy that has to be balanced in them. Let's go to the next slide. Light and dark effects on melatonin. Melatonin and the release of melatonin is really a function of the pineal gland. And when you go to sleep, when you're in darkness, when the eyes are closed, you have a sense of deep rest. When your eyes are closed and you're not sleeping and you're meditating, you're also taking advantage of having melatonin released into your system. Closing the eyes usually makes a person feel better. However, people with immune system disorders have usually a hard time closing the eyes and going inside. They will say, I have insomnia. I can't sleep. I can't just close my eyes and go to sleep. They want to keep their eyes open. They want to stay alert. They say they can't meditate. They tried meditation. They can't concentrate. They have many reasons why they cannot close the eyes and see the darkness, because there is an issue with the pineal gland, considered the third eye, that disrupts the sleeping, the dreaming, and actual consciousness. This is something that has to be balanced in order to achieve a balanced immune system. Next slide. The thymus, the storehouse and regulator of the immune system. This is probably the most important gland. It's actually an organ and a gland that has to be addressed. The T cells developed in the bone marrow, but they mature in the thymus, and then they are released into the bloodstream from the thymus. Next slide. Now, there's a similarity between the immune system and the endocrine system. But the endocrine system also considers the thyroid, parathyroid, pancreas, adrenal, sex organs, and very importantly, considers the mother's placenta during pregnancy. I'm going to explain later why that is an important consideration. Next slide. The pituitary hormones, oxytocin. I'm going to focus in on several of the feel-good hormones that are released from the pituitary. Oxytocin controls maternal behavior, social bonding, lowers inflammation, and increases wound healing. Now, ACTH, cortisol, regulates the adrenal response to stress. Cortisol regulates the adrenal response to stress. Next slide. Melatonin. Melatonin is what I consider the key hormone, affecting, benefiting, and calming many of the aspects of the immune system. It is melatonin that's released when the pineal gland goes inside and you feel comfortable and you're sleeping. Melatonin is released to create a more calming influence in the body. Next slide. Now, oxytocin. It's similar to melatonin. It also affects the immune system, maternal behavior, happiness, trust, cognitive memory, reproductive behavior. This pathway from the hypothalamus to the pituitary, and the pituitary gland has both anterior and posterior. And it's the posterior that produces and releases the hormones to the reproductive behavior. But the anterior has all the emotional, the ones I listed: happiness, trust, memory, information. It reduces stress and reduces anxiety, reduces fear. These are what the effects of having a good level of oxytocin in the system. Next slide. Serotonin. Serotonin is interesting because it has the same ability and properties as the others, but it's released from the intestines. It regulates social behavior, reward, adaptability, which is important, memory, anxiety, impulsivity, panic, sensory, motor, autonomic functions, modulation, and nociception. The gut-brain axis is very important because in order to really balance the immune system, you have to have a good digestive system that is signaling the brain, especially when you have a, let's say, and I treated gut disorders where unwanted and undesired, undigested food is passing into the bloodstream, the leaky gut. So that you can treat the leaky gut and create a good wall to stop those unwanted pathogens entering into the bloodstream. But if the immune system is not functioning properly, that will return. So in order to really get the whole digestive system working, the serotonin has to be addressed. The immune system has to be addressed. Next slide. Now, depression. Depression occurs when there are low levels of melatonin, oxytocin, and serotonin. And there are high levels of cortisol and adrenaline. Next slide. This is the stress response system. An increase of these hormones sets off the stress response. You can see from the brain, they have there the brain, the hypothalamus, and then goes down to the adrenals and the kidneys, and from there released into the bloodstream to affect. It affects the lungs, the breathing, the liver, the menstrual cycle, the digestive, stomach, intestines, the heart, and the heart rate is affected. Whenever you have a defensive fight or flight, sleep, wake, fear, anxiety, anger, sorrow, worry, whenever any of that stuff is going on, the organs will be affected. And that in turn throws the whole immune system off. The imbalance occurs in any area of the body. Next slide. The parasympathetic and the sympathetic nerves. This is the human nervous system. And I'm just going to outline a little bit here. The parasympathetic is responsible for the relaxation, normal functioning of heart rate, digestion, and body activity. The parasympathetic is going on. We swallow, we breathe without thinking, without doing anything. It just happens. And that is a normal level that has to also be addressed in order to balance the immune system. The sympathetic nervous system, this is where we learn to respond to danger, a perceived threat. And what happens? There is an increased heart rate and the fight or flight response to whatever's going on. Next slide. The most important part of the parasympathetic nervous system is the vagus nerve. It happens to be the longest nerve of the body, affecting all the organs of the body, and it's continually corresponding with the hypothalamus at the brain stem. Every area of the body is related to the vagus nerve. And if there's a perceived threat, the parasympathetic is going to respond. It's going to send a message to the hypothalamus, and the hypothalamus is going to release serotonin, oxytocin, melatonin, or it's going to release cortisol, adrenaline to prepare for fight or flight. This is a condition that happens throughout the whole nervous system by way and conducted through the vagus nerve. And that is an important part to address. And later on, we'll see how it's addressed. Next slide. This slide is repeating a bit of what I said. The heart, the liver, the gut, inflammation, the brain, the mouth, the blood vessels, they're all affected. If the perceived message to the vagus nerve is fight or flight, or if it's let's rest, that communication to the hypothalamus especially, that messaging back and forth is what's going to determine and contribute to stabilizing or flaring up the immune system. Next slide. The digestive system. The second brain. It detects dietary pathogens and alerts the immune system. Serotonin, which is produced in the small intestine, melatonin and oxytocin also regulate motility, secretion, permeability, and the intestinal barrier function, influence the gut microbia composition. The actual gut microbia composition, the way the microbiota is composed, how it's made, is determined by which hormones are in the intestines. Next slide. The gut microbiome and the immune disorders. I saw a very interesting Netflix documentary called Hack Your Health, The Secrets of Your Gut. And one of the interesting things that I learned in that is that in fecal matter transplant, which is being studied mainly in Europe, in fecal matter transplant, the system's issues in a person can be transferred to another person when fecal matter is transferred. In other words, in the show, they demonstrate that this young lady had an immune system disorder. And it just so happened either, I think it was her boyfriend or her brother, didn't have that problem. So they tried the fecal matter transplant, and over a period of a month, her symptoms were practically all gone. But yet she developed the symptoms of acne or dandruff that he had. And I noted that you can actually learn, the immune system can learn and adapt according to what the microbiome of the body is. That relationship between the intestines and the brain, releasing which hormones, will restructure the actual development of the adaptability, the acceptance and adaptability to the outer exterior influences, to whatever stimuli it's given. And that confirms what I was thinking, that the immune system can learn to accept and adapt to whatever the outer conditions are, depending on how the inner microbiome and the inner thinking, experiencing, perception of the person is in terms of nature itself. Next slide. the reproductive system. And I can confirm this, excessive levels of estrogen inflames the immune response. The immune response, when estrogen is at a proper level, is fine, is normal. But when the levels of the estrogen go too high, they can inflame the immune response and cause the anxiety, the fear, the anger to flare up. Next slide. And in turn, testosterone. If excessive levels of testosterone suppresses the immune system, your immune system can become weak if your testosterone level is excessive. Normal levels of testosterone, fine. That creates a normal, balanced homeostasis. But if either of those are excessive, the testosterone, if it's excessive, will suppress the immune system. And if estrogen is too high, it will flare up the immune system. So those two also have to be addressed. Next slide. Now, there's a cellular level to immunity. I'm not a specialist, but in this area, there is the innate and adaptive immunity. Innate means, of course, immediate physical barriers against germs, cells that attack and engulf invaders. And those cells, we don't have to do anything. They're going to be there and they act because they are innate. We don't think about doing anything to make them better or worse. They just act the way they normally do. The adaptive ones, however, they're the ones that we develop over time. They are specific, effective, long-lasting, the B and T lymphocytes that target infected cells. We adapt with those cells. There's an adaptive aspect to it. You remember when I said about the tonsils, that it has memory. We develop over time how to respond to different things. And if something is bothering us, we respond to that. The perception of a fear or something dangerous causes fear, and we respond with the fight or flight syndrome, which can set off the immune system. Next slide. What triggers the immune system flare-up? Again, perception, experience, emotional memories. Accept and adaptability are the key factors that determine the hormonal response of the immune system. If you respond calmly, relaxed, you release melatonin, serotonin, oxytocin. However, if you respond with fight or flight, adrenaline and cortisol, if you have a sense of fear of everything, anger towards everything, anxiety from everything, if you have too much grief, if you over worry, you're going to be releasing adrenaline and cortisol on a regular basis. So these are the important key factors that I consider when treating the immune system. Next slide. Now I want to picture for you a scenario of immune system disorder. Because when a patient comes in to see you, you have to somehow be in their shoes. And the way I saw the patients whenever they came in and explained to me what they had gone through. I remember this sort of scenario to get a picture. Imagine a young lady patient is going to visit her friend, a lady friend, and they're going to have a get together that they haven't seen each other in, let's say, a month, and they're going to get together and have a friendly evening. She goes and she visits her at her house. They share some wine and some ice cream or cake or whatever, cookies, and they start talking and having a good time. After a while, she has to go to the bathroom. And she goes up the stairs. She knows the house. She's been there before. Goes up the stairs to the bathroom, and she opens the door, and the room is very dark. And she reaches for the light. Before she can reach for the light, the door slams closed and she's in the darkness. And she feels the wall and she can't find the light. And while she's struggling to find the light, she senses something trying to hit her. And she starts to panic. And she searches for the light and she can't find the light switch, and she's swinging to try to stop that thing that's approaching her and trying to hit her and try to hurt her. And she can't. It seems to come and go and avoiding her, and she can't protect herself. She's in a full-blown traumatic hysteria. And she screams. Her friend comes up, turns on the lights, and she sees that the curtain from the open window was blowing towards her. And she's a bit embarrassed. And she's a little angry. And she's upset. A friend leaves her, goes downstairs. She leaves the house. They don't say a word. And then she's going to come to your office and say that her immune system flared up. And it happens a lot. Things that shouldn't be affecting her as much as they do. And this is when you have to listen. Next slide. Next slide. This is what you have to determine when she comes in, when the patient comes in. What is the modus operandi, the general way of being that your patient has? Do they exhibit a loving manner? And maybe they might be exhibiting the loving manner while she's in your office. But what is the general way that she goes through the day? Does she have a loving manner, or does she have a suspect, reject manner? Does she accept and adapt to normal cycles like sleep and wake, life and death? Feelings come first, or is thoughts come first? One has a attitude of don't worry, be happy. The other one has unable to accept or adapt to normal cycles, defensive, fear, fight or flight, thoughts come first, and over worry. Okay, I think we're being asked to take a 10-minute break. When I get rolling, I don't like to stop, but let's take a 10-minute break and stretch out a little bit and come back. We'll pick it up right here.
All right, sounds good. See everyone back here at 10:10 a.m. Pacific time.